Hello, my name is Stephanie Chekia, and I will be doing a presentation on the skeletal system today. Today I will be joined by my two helpers. I have Skelly and Scully. Now we're going to talk first about the main components of the skeletal system. The skeletal system includes the bones, the cartilage, the ligaments, and other connective tissues. Bones can be classified according to their shape. We have the sutural bones, which are found in between the flat bones of the skull. We have the pneumatized bones. They contain air pockets, such as the ethmoid bone, which we will discuss later. It is in the top of the skull. We have the short bones, which are their external surfaces are covered by compact bone, but the internal component is made up of a spongy bone. The examples of short bones are the carpal bones, such as the wrists, and the tarsal bones, or the ankles. We have irregular bones, which are complex shapes. They are with short, flat, notched or rigid structures. We have them are the vertebrae, and that forms the spinal column, and also and also several bones in the skull. Now we will also have the flat bones, which are thin parallel surfaces of compact bones. They protect underlying soft tissue, and the flat bones are present in the roof of the skull, the sternum, the ribs, and the scapula. Now we also have the long bones, which are relatively long and slender. They are found in the upper and lower limbs. There's in the humerus, the radius, the ulna, the femur, and the tibia and fibula. We also have the sesamoid bones, which develop most often inside tendons and are mostly encountered near the joints of your hands and feet. Now we're going to talk about the bones of the cranium. There are 8 bones in the cranium that determine the shape of the head. They house the special sense organs related to vision, sense of smell, and hearing. We have the occipital bone, which forms the posterior and lateral surfaces of the cranium. It is what makes the skull round. We have the parietal bones. There are 2 of them, and they form the most superior and lateral surface of the cranium, and they are also separated by the parietal suture. We have the temporal bones, which there are 2 of, and on the lateral sides of the skull. They also form a part of the cheekbone. We have the frontal bone, which would be the forehead and the superior part of the orbits of the eyes. Now, inside the skull, we have the sphenoid, which is shaped like a butterfly. And then we have the ethmoid, which also makes up part of the nasal cavity and also forms part of the orbit of the eye. Now we have the axial skeleton, which consists of the bones of the skull, the thorax, and the vertebral column. It forms a framework that supports and protects the organs in the thoracic and pelvic cavities. It also houses special sense organs for balance, performs respiratory movements, provides areas for the muscles to attach to and adjust in position. There are 80 associated skull bones. We have the thoracic cage, which is made up of the sternum, and the ribs. So that would be all over here. We have the vertebral column, which is made up of the vertebrae, the sacrum, and the coccyx. Now we have the appendicular system, which is made up of 126 bones. We have the pelvic girdle, and we have the pectoral girdle. We have the clavicles up here. There are 2 of them. We have the scapulae back here. We have 2 of these as well. We have the upper limbs, which would be the 2 humerus, the 2 radius, and 2 ulna. Then we'll go down to the carpal bones, which are also the wrists. We have the metacarpals, which would be the tops of the hands, and the phalanges down over at the bottom. Now, the pelvic girdle is made up of hip bones. And then we have the lower limbs, which there are 60 bones within there. There is the femur, the 2 patella. Oh, I'm so sorry, not in frame. We have the femur, the 2 patella. We have the tibia and the fibula. The tarsal bones down here, the metatarsals, and the phalanges. Now, a question was in clinical practice, how would knowing anatomy of the skeletal system, how will that help me in clinical practice? And knowing the anatomy of every part of the body is helpful, just to know the way that one part associates with the other. But also if you had to explain to a patient in a visual way the different parts so that they could understand in a visual model. Some people are at all different capacity of learning, and maybe just like showing them what part of their body it's being affected and like what other areas they would just maybe better understand. So that's it for this week, and bye.